Um, we have the question and answer session now. You want to come up? Yeah. Maybe can the speakers come to the stage? Any questions at all? No questions? Yes. I think for the benefit of the rest, can you repeat it in the mic? Yeah.
My question is, am I on? Yeah. Now, the CPG is silent on the type of implant, such as whether the length of the implant, in particular, whether anything that is below 10 millimeters is recommended. And also, the CPG is silent on the number of implants to be used in a full arch case, whether the prosthodontic part should be sort of stress broken, and you know, and the other issue on growth factors and things like that. So is this going to be added into the future copy, or is it going to be final?
Well, as I said earlier on, it cannot be, this CPG is not meant to be a comprehensive textbook on dental implants. And even those questions that we have already addressed, some of the information may be outdated after a few years, so it will definitely need to be reviewed. And those issues that you raise, you'll certainly be very welcome to join the next work group. Absolutely, I agree with you. Absolutely. I think for this round we tackled the skinny ones. The next round we tackled the short ones.
And the other issue that was mentioned was imaging. I mean, for a practicing clinician, the problem will arise. The problem will arise when there are complications. And when there are complications, this is where the lawyer is going to get hold of this. And they said, where are the guidelines on your imaging? Now, is 3D imaging compulsory? That's probably the lawyer will ask. And that will really impact when you got patients, you get sinusitis, patient has got nerve sensory deficit. Because these are important issues. And this is, I think your committee has to give us some GPP at least, if there are no actual sort of meta-analysis or grade A sort of test evidence. Thank you.
Actually, our appointed rep working with the College of Radiologists on this, isn't it? Okay, we cannot address everything in this CPG, because even as it is now, with the 12 questions that we identified, it took us almost 3 years from the first meeting, or rather maybe from the prioritization exercise until it's published today. The imaging part, actually, the plan, the college plan is actually to have a separate thing on. We can't do it on our own because we are already planning to do it together with the College of Radiologists. So it will be an inter-college work group. Some groundwork were laid, but then I think along the way, change of office holders and all that, things get a bit derailed. So we'll pick that up again. Other questions? How about the audience in the other room? Actually, now they have a lot of seats here. If you want to join the party over this side, you're most welcome to come over. Any questions? I promise I won't.
This thing called a stress breaker. We name it, however, it's not going to change it. The total magnitude of force is a matter of your muscles. Maybe some parafunction as well. The second thing about how many implants, how long the implant should be, how short should they be, how they should distribute. This, frankly, really is the art of prosthodontics. Prosthodontics is not about prepping teeth. It is not about making impression. It's about being master treatment planners. That's what I was taught. If David may have some other comments.
David, no comments?